Today we're going to go up and check on Monty. He lives in a cabin up there, so he's going to have more snow to deal with. This cabin was his family cabin for his summer place, so there's no insulation in it. And his heat source this year is wood. I assist people with any barrier.
I go by Monty. I'm 63, and I'm a plumber, or used to be a plumber before my stroke. Now I can't work, so I'm lucky to walk. For at least 2, maybe 3 months before anybody knew, I was in such a way that I couldn't even walk because my knees and my ankles were so swollen up, and it was so unbelievably painful that I couldn't do much of anything at all. You know, I've always been independent, able to care for myself, and now all of a sudden I can't. I have to depend on people like Maureen to help me out, and that really isn't conducive to my way of thinking, to tell you the truth. I've always, like I said, been independent as could be. The neighbor came over and he saw my plight. Well, I guess he contacted social services, and then they got a hold of Maureen, and things started to happen for me.
Says, "Do you want your wife to come back?"
Boy, was she ever a help. She has propagated several services for me insofar as help and doctor's services, and without her, I'm sure none of that would have ever happened. In spite of all the trouble I give her, she's been a godsend.
At the beginning, Monty went from having to crawl around for his method of ambulation. So he went from not walking to walking with assistance with a walker, to walking with a walker with some dizziness, and then graduated to 2 canes, actually, 2 ski poles, and now he's down to 1 ski pole. He discovered the ski pole worked better outside, which is brilliant, because in the snow you can plant it. So when you have somebody that's stubborn and they know it, that's what gives them their starch. But then the challenge to a navigator or anybody working with them in the realm of healthcare is to get them to understand why they're doing what they're doing. We hook people up to the resources they need. So as a patient navigator, I assist people with any barrier to healthcare. In Grand County, our current top 3 barriers are transportation. Number 2 is a lot of people don't have health insurance. A lot of that is because people work 2 or 3 part-time jobs or seasonal work, and so there's no health insurance affiliated with that. And the number 3 is finances. Grand County does have a lot of people living at the poverty line or below, and they know this and accept this because employment is seasonal. It's a small price to pay for the beauty and joy of living in the mountains. And you have to get that to approach them where they're at. And then to kind of just take a step into their world, to maybe link arms with them so that we can walk towards a better health outcome for them.